Artificial Intelligence Dr. ABC Pharma Net. User question: how does circadian modulation of autonomic tone influence patient perception of low-rate ventricular pacing? Co-pilot answer: circadian modulation of autonomic tone plays a pivotal role in how patients perceive low-rate ventricular pacing, especially with leadless pacemakers like the Avere VR-LP. Here's a breakdown of the mechanisms and implications. Autonomic tone and circadian rhythms. Daytime. Dominated by sympathetic tone, which increases heart rate, blood pressure, and metabolic demand. Patients are more alert and physically active. Nighttime. Dominated by parasympathetic tone, particularly vagal activity, which slows heart rate and promotes rest and recovery. Impact on perception of low-rate pacing. At 50 BPM during the day. The mismatch between sympathetic drive and artificially low heart rate may lead to perceived hypoperfusion, fatigue, or vague discomfort. The brain may interpret this as a threat to homeostasis, triggering subtle symptoms like anxiety, dyspnea, or malaise. At 50 BPM during the night, the low rate aligns with natural circadian bradycardia, especially during deep sleep stages. Sensory gating during sleep reduces visceral awareness, making pacing imperceptible. Neurocardiac integration. The central nervous system integrates signals from baroreceptors, chemoreceptors, and cardiac afferents. During wakefulness, cortical filtering is reduced, making patients more aware of internal sensations. At night, the lambic and cortical suppression of visceral input minimizes perception of pacing-related signals. Clinical implications. Chronotherapy. Adjusting pacing parameters based on time of day may improve comfort. Rate-adaptive algorithms that mimic physiological circadian rhythms could reduce daytime discomfort. Patient education about these mechanisms may help normalize the experience and reduce anxiety.